Medication for depression. People with more severe depression are likely to need some medication. Severe depression means it's having a very significant impact on the person's daily life and well-being. The most commonly prescribed antidepressants are serotonin reuptake inhibitors or SSRIs, such as sertraline and citalopram. Other classes of drugs may be used if SSRIs are not tolerated or have failed to work. Antidepressants affect the chemical messengers within the brain, which helps improve mood and symptoms of depression. Antidepressants are prescribed by a doctor or prescriber who's assessed the older person and agreed a diagnosis of depression with them. Older people should be started on a low dose and increased slowly to minimise side effects. It can take between 2 and 4 weeks to start to feel better. If no improvement is seen after 4 weeks of taking an antidepressant, the older person should go back to see the person who prescribed it. They may suggest increasing the dose or trying a different medicine. The older person should be reviewed regularly when taking an antidepressant. Some people may feel anxious when the medication is first started. If the person is severely anxious or symptoms of depression worsen, especially if they experience any suicidal thoughts after taking the antidepressant, then they should talk to their prescriber. Nausea and vomiting are common side effects for a couple of days when starting an SSRI. They should improve as the older person gets used to the medication. Taking medication with or after food helps reduce these side effects for some people. A full list of side effects is available in the information sheet provided with the medication. If the older person is concerned about any side effects, they should contact their prescriber. People should continue taking antidepressants even after their symptoms have resolved. Their prescriber will advise when it's safe to reduce and stop taking them, but it's usual to continue them for at least 6 months after their symptoms have gone. Antidepressants are not addictive. You do not need to take more and more of them to get the same effect. They can cause uncomfortable symptoms if stopped suddenly. It's important to talk to the prescriber before stopping antidepressants. They'll advise on the best way to slowly reduce the medication and should offer support while the medication is reduced.